if I have seen somebody who has failed physical therapy treatment in the past, it's usually for one of two reasons. Either the diagnosis was not done correctly. People did not take the time to really dig in and run through the tests and look at what is the actual pain generating tissue, what's actually causing the problem. And if that's the case, you can do all the best treatment in the world, but it's not going to work because we haven't found what the source of the pain is. Hey everyone, Derek Hines here. Welcome to the podcast where I'll share with you the patterns, insights, research, and technologies that we use in my own pain and performance practice to help people improve their health, speed their healing, and increase their longevity. Thanks for listening. I hope you enjoy it. Good day, my friends. I hope y'all are doing great. I'm excited to have y'all for another Tea with Dr. D. Welcome. I am apparently Rachel today. So where are we at? Part of the dream team. So I hope y'all are doing great. So what we do with this, if you're new to Tea with Dr. D, is basically jump on any questions that you have, any questions that I've gotten. You can text us to get those questions in Tuesday or Wednesday every month. We'll try and get that a little. So says I have a torn rotator cuff and would like to avoid surgery. Could I use BPC 157, which is a regenerative peptide? I'll kind of explain that in a moment. Or what is the best protocol? So if we're looking at regenerative therapy and we're looking at trying to take something like a torn rotator cuff and build up the tensile strength around that to make sure that it is healthy, then in that situation, we need to make sure that we're taking all of the right things and we're doing the right things. So what this would look like in our situation is we would do an ultrasound imaging session to take a look at the tissue to see exactly what extent the rotator cuff muscle or tendons are torn. So I want to see that. The other thing that gives us is the ability to treat under ultrasound guidance. So we can be looking at the damage. And as we look at what the extent of that is, it kind of answers the question is, can this be healed without surgery? Just my kind of experience around this, anything under the 50% tear range has healed fantastic. I've seen some 60, 70% tears heal all the way up to a full functioning pec muscle, rotator cuff tendon, hamstring tendon. We've seen a little bit in the patella region and bicep tendon. So we can heal a lot of this stuff very, very well in our office. So BPC 157 is something we use. That's a peptide that can help regenerate healthy tissue. And when you do that, one of the things that we see with it a lot is that the peptide goes and tells all of the tissues in your body that have some damage to heal. It starts in the stomach and then kind of spreads out. What we want to do is be with that. And so what we would look at with it is, can I tell your body that this is the primary healing site? So if I have a rotator cuff tendon, what we would do in our office is we'd have a few sessions a week where we do medical dry needling following that tendon and the attachment and the muscle. So everything in there, your body is recognizing this is where the problem is at. So that's where it's going to send the bulk of the healing agents. And if we have a regenerative agent like BPC 157 in the body, then we can use that to direct towards that primary injury site. Now, there's another component to this, which is we need to make sure that the body has the energy to rebuild the tissue. That's a energy consuming process. If your body's trying to rebuild healthy tissue, you're going to have trouble if those cells don't have the energy. So what we do is come behind and use something called high intensity laser. And when we do that, that high intensity laser basically gives us the ability to turn on the repair process at like a 6 to 7x what those cells could do because they're just producing so much more energy. So when we look at something like this, we want it, if you're guessing where those injuries are, you're going to have trouble, I think, healing this. So you want somebody who's doing ultrasound guidance, get in there, take a look at the tendon injury. We need to be doing some stimulant to stimulate the healing and regeneration process. I would take a regenerative agent. In this case, BPC 157 is a great starting point. Probably start at 250 to 500 micrograms a day. Try and take that first thing in the morning. And then you need some energy producing compound. PEMF, pulse electromagnetic field therapy, would be an alternative if you have access to that. And high intensity laser, very, very valuable in this situation. Once you get through that initial phase, that might take 60 days. Once you get through that, then what we would do is move you into the next phase, which is going to be starting to rebuild that tissue. And that's going to be very low and slow exercises, rehab exercises with almost no weight. You might start with no weight at all, doing very simple exercises, and then build that up over probably another 60 to 90 days where you're going very, very slow and you're only in like 5% a week. But if we go through that, at the end of that, it's very, very likely that you have a completely healthy shoulder. You can throw, you can shoot, you can do everything you need to do. And that tendon is, for most purposes, very healthy. Now, once you hit that end of that second phase, you want to keep strengthening. When we look at these, we tell people, look, you're going to have about a year where you're continuing to build up the resiliency of that tissue. So keep doing it a couple times a week where you're getting in and training those tissues. I think at the end of that first phase, you'll have very minimal pain. At the end of the second phase, you'll have a lot of function. At the end of the third phase, you're using it and doing whatever you want. So that would be the best protocol look. So hopefully that helps, Eric, and you can kind of let us know if you have any questions on that. But yeah, thank you. Hopefully that helps you out a little bit. Samantha from I don't know Annette T. PT has failed to help me in the past, but I'm still hopeful I can find relief with a chronic neck problem. Any advice, and where are you located? Beautiful. Thank you, Annette. Hopefully we can tag you in this and get this out to you. So I'm sorry to hear that therapy has failed to help with the neck pain. I know that in treating a lot of people, if I have seen somebody who has failed physical therapy treatment in the past, it's usually for one of two reasons. Either the diagnosis was not done correctly. People did not take the time to really dig in and run through the tests and look at what is the actual pain generating tissue, what's actually causing the problem. And if that's the case, you can do all the best treatment in the world, but it's not going to work because we haven't found what the source of the pain is. The other part of this is that your body is having a difficult time healing whatever that problem is. And so a lot of times, if we're just doing the basic kind of physical therapy where you're doing some movement, some hands-on treatment, and exercise, even some of the modalities, then in that situation, you are likely not getting into what we just talked about, a regenerative segment of healing. So in these situations, you would look at it and say, well, my body isn't able to come in and heal this tissue. And if that's the case, we need to do more of that. So if you have a good diagnosis and you're quite clear on what's going on in there, then the next step is, well, the treatment hasn't given my body enough to repair that tissue. So if you have a good diagnosis, then the next step would be to start going and looking at regenerative therapy. There's levels to this. So as we just talked about, there's directed peptide treatment, which is going to use medical dry needling. You're going to take a peptide to create regeneration. A lot of times you'll add in a laser, PEMF, or something like that, that gives the cells the ability to repair. If you go above that, then you're going to be looking at doing something like PRP. Even with our PRP patients, we like to have them do high intensity laser because PRP is giving you the repair agent. Those cells still need the energy to do it. And we still want to go through, that gets us through the first phase if we have a PRP patient. And then the second phase is building that resiliency and starting with the movement again. And then you can go all the way up to stem cells in terms of regenerating healthy tissue. So It starts with diagnosis. Make sure you have a good diagnosis. And if you haven't been able to heal and get relief from it, I would say you probably haven't found the pain generating tissue. Is that a disc? Is that a muscle or a nerve? Is that a segmental problem where we're not moving something well? Is that a functional movement thing that you're repeating and not noticing? I think that all of those things can show up and see a problem. Or I would run down the algorithm and like, do I really think I have a good handle on what's causing my neck pain? If the answer is no to that, get into some different offices. I would look towards some regenerative therapy offices that do more than just kind of the traditional physical therapy, chiropractic, osteopathic, any of those things. I would find somebody who's going to do deeper testing to really try and identify what structure is causing your pain. And then at that point, if you really have a good diagnosis, you might be able to go the kind of basic movement and correction route. But if you've had some chronic issues, I would say step up and try and add in some of the advanced services. This is something we talk about a lot. A lot of providers are handcuffed by insurance reimbursement, and they can't bring the best of the best treatments to you. So we try and kind of bring that as a ability of get this as an add-on, so you can get the absolute best studied, researched treatments out there, the latest and most advanced things that get into regeneration, while you can kind of use your insurance at the same time. If you're not in a place that can do that, you may need to look outside of the insurance model and pay some cash to get really good regenerative treatment. But we are located, to answer that question, in Lafayette, Louisiana. We're in the oil center. If you know anything about Lafayette, we do treat people from out of town. You can give us a call. Our office number is 504-5144-337. And you can go to acadianapain.com, and that'll give you some good information about some of the stuff that we do. So I hope that helps you. I hope you get a good relief from that and find some answers for it. I know chronic neck pain and problems can really be debilitating because it's so close. It's hard to have like easy conversations. As one of my patients said, like, when my neck hurts, my head hurts, and whenever that hurts, I can't hold a conversation. I just want to kind of curl up into a ball and turn the lights off. If we can get that solved first, let's start there. I think we were dealing with like a neck and a hip injury or like that. He was like, when my hip hurts, I can still be having fun, but when my neck hurts, everything shuts down. So hopefully that helps you, Annette. Cool. Let's go. Ryan. I think I know which Ryan this is, but are there any exercises that you can do to prevent back pain or back injury? That's a great question. We get this all the time, and I love this area where we're trying to look, can I be ahead of these things? The T is a decaf matcha, actually, which is kind of a new one, but I think I like it. I haven't seen any matchas that were decaffeinated, so this was an interesting one. I don't know if they've done a chemical process to that, but pretty good. So if we're looking at exercises that will prevent back injuries, a lot of times I want people to try and categorize themselves. Am I mobile? Am I loose, or am I too tight? So just basic kind of categories. Can I move really, really well? And am I really bendy? Or am I really tight over here and I have trouble bending and touching my toes and all that stuff? So if we're going to start with the really bendy person, hey, I can move well, I'm just having a lot of pain. Then what we want to do is create a stiffness across the spine and across the disc, the ability to tense up whenever we're moving or we're lifting things. And so if that's the case, then we are going to try to run through, usually the McGill big three would be what we would consider with that. And so when we look at some of those things, you would say, let's go through and let's do a bird dog, an alternate arm and leg exercise. You can Google the McGill 3 and these will pop up. But so basically you're going to do a bird dog exercise. That's where you would like be on all fours. You'd raise your right arm and you'd kick up your left leg, and you're going to hold that at the top for 3 seconds. So you're tightening the stomach and you're tightening, you're trying to have a very straight back as you kind of do that. We're going to run through that, and we're going to do 3 sets of 10 of those. The other exercise on there is going to be a side plank, where you're on your side and we're going to hold in that side plank position. We're going to try and tense that up. We're going to hold that for 15 to 30 seconds, start where you're at. And we're going to do 3 sets on each side of that one. And then the last one that they studied is you're going to do a curl up. You're laid flat on your back, one leg bent, hands behind your back, and you're going to tighten the core, pull the stomach in, and do a little bitty crunch and hold that for 3 seconds. And we're doing 3 sets of 10 of those. Those 3 exercises are so good at increasing stability and tension across the back that you can do those every day. That's what we tell our patients. If you're in that category and we need more stability in your back, then that's your answer, is every day, get down, do your bird dog, hold for 3 seconds, do 3 sets of 10, do your side planks, hold for 15 to 30 seconds, depending on what you can, 3 times on each side, and then do your curl ups, hold for 3 seconds, do 3 sets of 10 of those. That increases stability very, very significantly. So that would be my starting point. If you are in the, hey, I can move fairly well, I can bend, I can do a lot of that stuff, I consider myself fairly mobile. Now, if we're on the other side where we're like, look, I haven't touched my toe 20 years. I can barely forward to put my shoes on, all of those things. Now we're going to flip it over. What we're trying to do is stretch out the tissues that are compressing the spine. So instead of doing tension training every day, we're going to do relaxation training every day. So we can stretch the hip flexor, so psoas muscle. That's getting on a knee. You can Google psoas stretch, OAS, and you're going to hold that, start at a minute. It's a big muscle. We really need to stretch that thing out. And we're going to do that 3 times on each side. And then we're going to do a piriformis stretch. That's like the pigeon pose for those who do yoga. And we're going to hold that one for a minute on each side. These are all going to start really difficult for you. And then the other one that we want to start to do is a cross leg flexion stretch. You're going to try and sit cross leg like you did when you were a kid. So you're trying to sit down, and then you're trying to reach forward, put your back against like a wall or something, and stack some cushions up. And in the beginning, you're going to barely be able to get down, and then you can barely lean forward. And then as you loosen up, what you'll notice is like I can move a cushion away, and my hips aren't super, super tight, and my back's not really tight. So, and you'll do that one for a minute 3 times. So those are the 3. If I can't move, I need to take the tension off the spine. So the biggest tensors are going to be that hip flexor, all of the paraspinal muscles in the back, including all your deep rotators in there. And then a lot of the lateral hip muscles can create tension that prevents normal motion. So we want to get the piriformis in there. So if I can't move and I don't have any motion every day, we're going to stretch the psoas muscle, piriformis muscle, and do a cross lumbar flexion stretch, cross leg lumbar flexion stretch. Hopefully those make some sense. You can Google those and they'll likely pop up. But that's the main ones that start to do that help you prevent a back injury or back pain. Now, I'll tell you the caveat to this is train. Like those are the easy answers, but the tough answer is like the stronger your core is, the better balance and stability we have, and then the better mobility we have, the more resilient all those tissues and discs are. I like a very adaptable spine. So we want people to be able to move in lots of different directions and train those things. So we very regularly have patients sitting and bending from their back with like a PVC pipe or a weight over it. They tell us never do that. Don't bend, don't bend. Well, then when you go to bend and you have to, your body's never going to do with that. And so if you haven't trained it how to do it, you're going to have a tough time with it. So in those situations, we definitely want to start to create resiliency. What are that you're going to be doing that you're going to move in different ways and start very easy and start building up the ability for you to do those moves over and over again. So that's the hard part of this, is like actually training and strengthening and putting in some of the effort to get your core, your back, and your hips really strong and stable. So hopefully that answers your question. You have a couple easy ones. Check out the McGill Big Three if you need them. And then if you're really tight, you're not moving, do the big 3 stretches and start there. Do that every day. You'll make some progress, and you will start to kind of feel like that's moving better. You're having less tension, you're having less pain, or you're having more stability. So hopefully that helps if you can follow some of that stuff, Ryan. So good stuff. I think that is going to do it for the current questions that I have, unless y'all have anything else for me. Y'all are good. Thank y'all for joining in with us. Heather, Kaylin, thank you for jumping in. Eric, glad to see you. Jenny, all of y'all fun people. Thank y'all for tuning in. We will try to be doing this every month. I'm going to be making sure that I'm getting all of your questions. If you have anything and we can help in any way, text me, give our office a call, 504-5144. You can go to acadianapain.com if you're from out of town. It's got a bunch of information on there. So I hope that everybody gets a little bit healthier and has a great day. Thank y'all for joining me on Tea with Dr. D. And remember, just have a little bit healthier day than you think you possibly could.